Hi, I'm Dr. Angeli Maun Akey.
And I'm Dr. Kathleen O'Neil-Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine Docu-Series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello, everyone. Happy Thursday and welcome back to the FIRRIMup Doctors webinar series. My name is Audrey and today we'll be diving into the second episode of our COVID series. Today it's all about prevention and fortifying the immune system against COVID. So with that being said, I'll pass it on to our wonderful FIRRIMup doctors, Dr. Angeli Akey and Dr. Kathleen O'Neil-Smith.
Hi, everybody. Hi, Audrey. Hi, Dr. Kathleen. How's everyone doing today?
Everybody's good.
We're good here in Florida. There's no snow.
Lots of snow in Boston. I've been shoveling.
So we're going back to basics in the series. We're going to review from our book, Kick COVID-19 to the Curb, reinforcing prevention and immune fortification today. Next week, so we'll talk about what to do if you've been exposed. We've had a lot of those calls. The week after, we'll talk about COVID illness management. And then finally, we'll talk about an area that both Dr. Kathleen and I are very passionate about. In fact, we're designing a clinical trial to treat post-acute COVID syndrome patients, so people who have been injured after having COVID illness.
It's nice to just take it one step at a time, isn't it? Because this has really gotten into a flurry, and we really have things that we can do to fortify our immune system so that we're resilient.
So remember the story that you are the king of your castle, and that your castle is like your body, and it has entrances that can be fortified. In addition, you have an immune system army that, if given the right nutrients, you can fight quite well, even without having symptoms. So we wrote this book and we knew the way these supplements worked. And since then, there's been a lot of literature, for example, about vitamin D as in dog, in terms of decreasing morbidity and mortality, actually, of COVID-19 illness.
Well, the interesting thing about that literature, right, Dr. Akey, is that we've known these things. It's just that the conventional world is beginning to have to understand, the things that are happening. So what we're trying to do is, we know, hopefully you can hear me better now, but we know that the only way to fight this pandemic and whatever else is down the road from this is to fortify our immune system. So one way or the other, it's cheap enough, as we're going to show you later, to really pay attention and spend the money. It's a great investment on how to fortify your immune system.
Yeah, and we're talking about fortifying your immune system about other infections, but also in terms of like preventing illnesses like inflammatory illnesses and cancers, and just strengthening your immune system, because your immune system is so fundamental to your overall health and aging.
The immune system is what goes awry when you end up with autoimmunity, or when you end up with cancer or inflammatory diseases. So one way or the other, we can't ignore the immune system. Next slide. Thank you.
So I am so glad to have partnered with Dr. Kathleen, because she and I both believe in a very aggressive, preventative, integrative, functional medicine approach to managing our patients. And you can see it on the left there that it's wellness oriented. In fact, Dr. Kathleen's practice is called Treat Wellness in Boston, because it has to be managed, right? Dr. Kathleen, just being well has to be managed.
Wellness is about the patient and about optimizing systems within a patient and having them work together and individually work well, the systems, and then making sure that those systems work in an integrated fashion. When it's reactive, you're focusing on the disease, the diagnosis code, and the algorithms that have been set up for the diagnosis code. I think of that as more population-based and more unintegrated than I do the preventative integrative approach. And that's why, I've shifted from that world to this wellness world.
Yeah, and it pertains to exactly what we were messaging about individualizing discussions, for example, about the vaccine.
Absolutely.
That you have the public health system saying everyone get vaccinated. We're saying let's have an individual discussion to minimize your risk and maximize your benefit from getting a vaccine. When you look at our analogy from our book, preventative approach is like daily maintenance on the structure and function of your castle, and that makes sense, right? If you have a car, you want oil changes. You want to make sure you don't wait till the last minute because you might not be able to bring it back if you haven't done your maintenance on your car, even. So same with your castle. Whereas
I mean, I think that when you go in for a tune-up, you shouldn't just be looking at your body in terms of, do I have high blood pressure? Do I have diabetes? And now do I need a medicine? You should be trying to tune it up so that you don't get diabetes and that you don't get high blood pressure. That's the difference in wellness and sickness. Hopefully that's understood.
Yeah. And the other thing is that reactive approach, waiting till there's a problem, is like sending out your troops after your castle has already been infiltrated. Next slide. This is one of my favorite easy slides. And basically, there's two arms to your immune system. You have on the left, you have the innate immunity, which is like the first line forces. And it's balanced against your adaptive immunity on the right. The adaptive immunity is a slow response, and it takes a little bit long to learn. And that's where the antibodies part of your immune system comes. At about age 40, your immune system ages such that the adaptive immunity, the right side, goes down, and you tend to be more inflammatory. The left side goes up. But I also like this slide because it clearly shows how the left side, the innate immunity, interacts with the right side to make antibodies, which are the focus of this vaccine. But we also do need to remember that the adaptive immunity includes the T cell immunity, which includes natural killer cells. And so when we talk about your immune system, we're not only talking about antibodies, we're talking about balancing and fortifying your entire immune system army.
Well, the rapid and the slow are relative because the rapid's immediate. So your body knows, like external to it, in the nose, external to inside the body, in the GI tract. Your body knows when it's exposed to something. And these T cells and natural killer cells are activated instantaneously, immediately. It's like swelling or nose dripping or any of those things. The innate immunity gets, and the adaptive gets activated. The adaptive immunity acts quickly as well. But in order to get a full adaptation, can we go back to that slide, please? I like that one too, but I want to stay here for a minute. We need to, in order to have it to be it will take fully activated and effectively assisting us and guiding us and protecting us. It takes some time. But the T cells and the natural killer cells are necessary in order to activate antibodies. So when we think about T cells, vitamin C as part of our immune system boosting, which we don't make our own vitamin C, and that's critical to know. We are one of 2 mammals that do not make vitamin C. And vitamin C activates natural killer cells. So when I measure in my practice patients' natural killer cells, they have low levels. The percentages are very, very low of all of their cells, like you see on this screen. So it's really important to understand that we're activating natural killer cells with vitamin C. We're activating macrophages and dendritic cells and eosinophils and other cells with quercetin. So it's really important to think about this innate immune response and the recommendations that we're suggesting that you take to be protected by your immune system in an optimal way.
Yeah, so I love those natural killer cells. They're like the ninjas. They actually go and just kill things right away, be it a virus or be it early mutations in cancer cells. Mm-hmm. Really important for it to be healthy. Mm-hmm. Here it is illustrated from our book and in our analogy. So again, you have the innate immune system on the left, it's nonspecific defense. And then on the right, you have the adaptive immune system. and you're the king of your castle, and we're trying to protect all these entryways into your body. So we talk about the barriers on the outsiders of the skin, the barriers on the inside, the mucosal membranes like the nasopharynx, the pulmonary and GI tract. Really important. We actually on our basic immune prevention pack recommend colloidal silver topically, for example, in your nasopharynx. Zinc orally. Zinc is directly virucidal. If you had a virus in your mouth and you took a zinc lozenge, it would die. So really protecting the barriers. And then you have the antigen presenting cells, which are like the bishops. They basically engulf whatever the foreigners, in this case, the virus, and present it to the team on the right, which are the T cells, which you heard about. We call them the queen because they're so flexible. Those T cells are critical. And then the B as in boy cells, which are the knights, because they actually differentiate to cells that make your antibodies. And that takes somewhere between 7 and 14 days to start that process. So it's relatively slow, but it's still so it's really important to know that that's why you have to wait a couple weeks after the second vaccine to get that full 94.5% protection when you get those the vaccine series.
And to be honest, fortifying your immune system with vitamin C, quercetin, zinc, and all of these initial protection supplements will help you make better antibodies when you get the vaccine.
Absolutely. That's a huge point that I've made with my patients because they're like, oh, I'm getting the vaccine. Do I need to take my immune fortification? I said, well, when you get the vaccine, it's like faux COVID. It's a fake COVID condition. And if you really want to make good antibodies, you're going to want to make sure you fortified your immune system. Yeah.
So it's not a one or the other. It's actually both because everything works in an integrated fashion. Next slide, please. Perfect.
Don't forget your basics. Even if you've had the vaccine, wash your hands for 20 seconds, 2 happy birthdays. Don't touch those barriers. Like if you had virus on your hands and you rub your eyes and touch your nose and mouth, you will increase the risk of transmitting. Wear your mask, 6 feet of physical distancing, use at least 70% alcohol-based solution, and still continue to stay home. I had a patient an hour ago who came home, unfortunately, from his sister's funeral. He's in his 70s in Texas. And there was a lot of loving at that funeral, but lo and behold, he probably has COVID from that in his 70s, but he'd been so good all year. So yeah, still continue to do these basic things, even with the vaccine, which we'll talk about in a minute.
Yeah, I mean, I think, Dr. Fauci and the whole crew that are vaccine promoters, I mean, they basically say one of their fears about giving the vaccine is that people are going to stop wearing masks. The vaccine does not stop that you can transmit the virus through your nose. So Argentine silver, a mask, and now with these variants of the virus, they're more transmissible. So even if you get a vaccine, the recommendation is for double masking. So it's really, really important to think about that. I'm going to try going off of my Uber mic and see if that's better.
So let's go on to the supplements in our protocols, in our immune fortification protocols. Next slide. So the easiest way, okay. So we already went through this. These are actually the peer-reviewed articles that we published. There are 130 references from our Kick COVID-19 guidebook that we actually uploaded to our website if you want to access them as hot links. FIRRMupDoctors.com, FIRRIMupDoctors.com has 130 references. But what we did was we collated them into 3 or 4 pages in our guidebook, which we actually are showing you here, that this didn't just get pulled out of the air. There are actually animal and human studies, for example, basic science studies with vitamin C, as well as what Dr. Kathleen had told you that only 2 kinds of mammals don't make vitamin C and how critical that is. So if you have the C, the D, the omega-3, and the zinc information. And we call it the CDAWS protocol. So vitamin C, vitamin D, omega-3 fatty acids, and zinc. Very basic, like you don't even have to be part of our practice to take this. This is so basic. These are pennies a day. And so we already heard about C. Zinc is a directly virucidal. I told you that already. Usually like 25 milligrams. Should you be exposed, go up to 50 milligrams. Should you be treated with COVID, it's 100 milligrams. You can't be on high dose zinc for a long time because it'll change the zinc copper ratio. But if you got COVID today, I would actually put you on 100 milligrams of zinc for at least a week. Omega-3 fatty acids, you want to talk about that, Dr. Kathleen?
Yeah, omega-3 fatty acids, there's stacks of data on them and all of the different ways that they help in the immune system. But generally speaking, they're anti-inflammatory, and they also they thin the blood a little bit. So they're very, very beneficial. And I know that there's a question here, 2 questions from, I think, the same listener, that is about cod liver oil and whether it has omega-3 and vitamin D. And it does. But you need to look at your supplement regimen and look at the dosage and just make sure that the dosage is adequate per serving size. So that's really the key thing. I wouldn't be able to know if a specific supplement by any particular company has the right amount. That's what you need to look at. We've given ideas. And of course, 30 milligrams, 25 milligrams, 40 milligrams, it's all within a range. And if you have questions, you can obviously ask your physician. But generally speaking, the ranges are here in the supplement list in the book and on the website. So you can look at those, and you can then look at the supplement that you have and determine if you have the right amounts. And I think, I always think a little bit of something is a whole lot better than nothing. So the question on vitamin C is, you can separate your vitamins if you have the wherewithal to do that, or you can take them all at once. So sometimes, with C and iron, you have to be cautious, but with most of these other nutrients, you can take them together. But there are some small specifics. But if you're OCD or more structured, and you can say, I'm going to take something at 8 a.m. and noon and 4, then you can do it that way. But generally speaking, most people need to take things once. And so a little bit of something, regardless of it may have a reduced absorption, is better than a whole lot of nothing in my mind.
Yeah, and getting back to vitamin C, there are at least 3 academic studies within their COVID treatment protocols in the intensive care unit. They're using intravenous vitamin C, and we both offer it within our own private practices. So CDOS, vitamin C, D, omega-3, and zinc. If you've had calcium oxalate kidney stones, drink a lot of water when you take your Cs, or talk to your doctor. Then we talk about probiotics. There were many papers actually since that came out with the GI gastrointestinal microbiome and how important that is to be healthy, so that the SARS-CoV-2 virus doesn't invade through the gut.
Well, it also causes a dysbiosis, right? A microbiome imbalance in the gut, which I have multiple patients who have post-COVID syndrome who have GI issues. So for people who are prone towards problems in the gut, that's important to be remembering. A probiotic would be very beneficial.
Absolutely. And then curcumin is a root. It's the active ingredient of turmeric, which is a root spice, but it actually is an anti-inflammatory. It's actually a natural Motrin in the body. It's very, very safe. Then we have thiamine, which is vitamin B1. And that the reference is over there as well. So that's a tier 2 intervention.
Yeah, so these are more intermediate and much more specific. I do think the quercetin should be in the first one, and that's, information. We wrote this book back in March and April. So I think that you should remember that quercetin, as we've said over and over again, should be in the initial intervention for sure.
Very safe too.
600 milligrams, here it is.
Yeah, so we would have promoted it at this point.
Yeah. So quercetin we know, and melatonin we know, and people with adrenal issues, they may absolutely want astragalus. So I think that, again, it's really about what your underlying vulnerabilities and sensitivities and predispositions are. And that's the way that you would use these tiers, except for the basic tier. But if you have other things, for example, I have other things, I would definitely put astragalus right at the top. And when I think about my protocols for different patients, sometimes they're 8 or 10 supplements long. So it's really targeting COVID as an individual bug, as a specific bug, and then targeting what an individual will need.
Yeah, and to your point, we actually are offering telemedicine COVID consults, both Dr. Kathleen and myself, through the FIRRIMup Doctors company for COVID. So we are managing people outside of our local regions who have COVID. So if you have friends and family who aren't part of our practices, you could feel free to email that email, FIRRIMupDoctors.com, and inquire about one of those consults to individualize and tailor prevention, post-exposure prophylaxis, and management of acute illness.
Really important.
Okay. So these are more, colostrum, immunoglobulin G, that is the Numedica proline-rich peptide spray that I've been managing my patients with. So colostrum's helpful for the immune system. Elderberry, you really shouldn't use once you start getting fever and illness because it could perpetuate the inflammation. So that is an asterisk on that one. Some mushrooms actually increase natural killer cell function. So that would be an individualized discussion. And then beta glucan is part of our advanced immune pack at NFIM, and it actually helps. It's a polysaccharide that helps increase your immune system, your immunity, and antiviral activities.
All of these different supplements that increase the immunity act from different angles. So it's a multifactorial mechanism to really boost it. So if it's not one thing that you need, it's another. And you can find, I use regularly in the first line, medicinal mushroom and beta glucan combination. So there's a lot of ways to go about this. Yeah.
And you're different. Everybody's body's different. They have different cracks in their castle that we as physicians will help you identify to shore up something customized for those cracks. If that makes sense to you guys, that's what we try to do. Next slide. So yeah, we put together a FIRRIMup Doctors basic immune pack for you all. And the top line is the CDAWS protocol, vitamin C, D, omega-3 fatty acid, and zinc. That's the top line. You've got your quercetin in the left lower, and then you have your colloidal silver spray to protect your nasopharynx barrier. And something that we've messaged way back in August, talking about nitric oxide, which we didn't say much about this session. We may as well go back there since we're offering it first line for people. Do you want to talk about that, Dr. Kathleen? Dr. Nathan Bryan's product, Neo40 and nitric oxide.
Neo40 is really important to protect the blood vessels, the endothelium, and the blood vessels in the endothelium are synonymous. And we know that COVID is a blood vessel disease. So it's really, really important. And all diseases are blood vessel diseases. Getting leaky blood vessels is really problematic. Having plaque in your blood vessels is really problematic. And Neo40 is really important for vasodilating and keeping the inflammation out of the blood vessels. You can have hard plaque or you can have soft plaque. Either kind of plaque is not good in your blood vessels, just like plaque on your teeth is not good. But what I love about this basic immune pack and what we've done is we went and looked at what is the cost of this? How expensive is a program like this? And what we did was we tried to find a very cost-effective program. So $5 a day, right? I mean, to protect your immune system with including all of these nutrients, I can't think of anything better. I can't think of a better investment because it's really, these are very, very effective. And you can either pay a tiny bit now of $5 a day, even if you're on, reduced income. This is substantial for protecting what the cost would be. And the motto of my practice is, if you don't have time or money to be sick, because it costs to be sick, you have to make the time and spend a little bit of money to be well.
Yeah, that's a great line, Dr. Kathleen. But really, it's a cup of coffee, $5 a day in the middle of this pandemic for these supplements in our protocol. So she'll tell you more about it in a minute after we go through the questions. But we spent some time putting this together for you all, and the website's there if you want to check it out. So wrapping it up with updates. Next slide. So you've seen this multiple times. We have a lot going on, 18 million tests in Florida, 25,000 deaths. In our county, 20,000 confirmed cases, 164 deaths. I don't know. We had another patient die last week, Thursday. She was 90 years old. She was new to our practice because they heard we managed COVID on the computer. We sent her immediately after seeing her the second visit to the emergency room. She got admitted with COVID, got discharged, and died at home, actually, a couple days later. So she's death number 2. I'm actively managing a lot of COVID in the office. So we're over 90. So it's out there, everybody. Continue to keep your guard up. Do not let your guard down, especially if you haven't been vaccinated.
Or had it, right? With
Or had it,
antibodies.
right.
I mean, I think in Boston, I know that Massachusetts, it's one of the top states of where transmission is moving fast. And we've got total confirmed of 70,000 and 1,500 deaths. But I think that we're probably the one state you don't want to visit right now. And it's pretty quiet up here. I mean, having been in Florida with you versus being here, it's really quiet up here. I can't imagine where all these people are. And they must be having secret super spreader parties that I'm not invited to, but it's moving.
But yeah, look at your county. Your deaths are 10 times ours. So 164 in Alachua County, 1,500 in Suffolk County. That's amazing.
Yeah, pretty crazy.
And imagine being cold and quarantined in the snow up there.
Oh.
We have beautiful weather here in Florida. At least we can walk outside distanced.
Oh gosh, if anyone's selling a house on this webinar, let me know.
We'd love you to move to Florida. Vaccine tracker. So about 1.5 million vaccines in Florida, about 0.8% fully vaccinated. In the whole United States, about 24.6 million doses of either the Moderna or Pfizer vaccine has been distributed. But if you look at the Vaers website, that's the vaccine adverse reaction reporting site, there's not many reported. There's 817 adverse reactions reported. I spent a few minutes looking at that, and a lot of them are self-report for people who got the vaccine and then got COVID. There was only one case reported of an immune reaction called TTP, or a low platelet immune reaction called TTP, or they weren't sure if it was its sister ITP. But anyway, that's an autoimmune reaction to platelets. Then there was a doctor who got the vaccine and got a condition of neurological condition called nystagmus. And then they did her MRI and it showed inflammation of her brain and spinal cord. So meningoencephalitis. So, I think they're terribly being underreported. So 25 million vaccine doses have been given and only 817 adverse reactions reported.
No, left to our own devices to do the reporting. I mean, we need a better system to really understand. And you and I know that because of our vaccine study group. But I think that at least we've got these that are reported. And I do think that encephalitis can happen. We know that can happen with any vaccine, right? So I think it would be better if there was a plan of action for reporting these adverse events. Unfortunately, there's not.
Yeah. And then there was, out of all those 817, there was one death that happened 20 minutes after the dose. And then there was another death that happened 3 days later that they thought the lady was demented and it wasn't related. So really, I think we're terribly underreporting. But that said, I think if you're older and at risk, like I'm really happy my 81-year-old diabetic mother finally got her first vaccine last week. And it was the Alachua County Fire Rescue people that came to her house and dosed her husband and herself, and they're in their 80s. And I think in Alachua County, we're going backwards, like senior, and then going back down to the 65-year-olds.
Mm-hmm.
Next slide. Okay, we're going to go pretty quickly through these Q&As. Let me just pitch this one to you, Dr. Kathleen. If someone has gotten the second vaccination and is having a severe reaction like fever, chills, severe headache, would that person be dangerous to be around? Are they a carrier or transmitter of the virus?
Well, first of all, we don't know. So they have to be seen. They have to be tested. They need a nasal swab, obviously, and I would do a rapid and one that gets sent to the lab. And I would, absolutely follow them closely. You could also do, it'd be interesting to do at some point, it's a little tricky in terms of antibody checking, but remember, we can check IgM antibodies. So I would check natural killer cells, I would check IgM, I would check IgG, but I definitely would not I don't think that if they got the vaccine and they haven't been anywhere, it's unlikely that they're transmitting it through their nose to somebody else unless they already have been exposed to it previously. But I do think that this is a very serious situation, that the person who got the vaccine needs to be cared for. And this needs to be reported. This person needs to go to a clinic or an ER. And I think they need to be appropriately triaged. I don't think that they're transmitting it necessarily unless they had had it previously, but it is important to do all of the testing.
Great point. So that kind of reminds me of a vaccine reaction I saw earlier this week. And this is a healthcare worker, not frontline, but a healthcare worker in her 50s who actually had a local reaction. They're doing drive-through at our local hospital. So they drive-through reaction 3 weeks prior on a Pfizer vaccine, left arm, had a local reaction, meaning inflammation, then got lymph nodes. Not the case I told you about 2 weeks ago, but it's a new case. Gets lymph nodes in her neck. Then she goes by 3 weeks later and it's still inflamed and she gets injected in the same exact arm. So then she presented to me 2 days ago, feeling terrible, with the local reaction being worse on her arm and the lymph nodes still there or even worse. So I think that it should be a protocol. If there's 2 doses, you should use alternate arms, right? And she said, "Oh, I'm not doing that because I'm just sticking my arm out." But it makes sense to me that when I get the vaccine series, I would use one arm one time and the other arm the second time.
But nonetheless, the person needs an evaluation.
Yeah,
They
exactly.
should be evaluated with the reaction. If that reaction didn't clear pretty quickly, if they still had swollen lymph nodes and pain in the arm that had the vaccine, 10 days later, before getting a second dose, they needed to be seen.
Yeah, so there's really none of that. There's just like drive through, whatever, the parking lot. And if you've had a history of reactions, then you get to sit in the parking lot for another 20 minutes. All the vaccines are owned by the government. So the government is sequestering where the vaccines are getting. We've applied to be able to deliver them from our office, but they're not giving them to private offices at this point. But ideally, that would be a good situation because we'd
simplifying it. I would say if I had a child, if I had my own child who's 5 years old or 6 years old, and they had swollen lymph nodes for 2 weeks after a vaccine, would you really bring them back and give them a second dose of the vaccine? I don't think so. You'd want them to be checked. You'd be worried. We should treat adults the same way, right? Everybody should be treated with the same type of TLC, tender loving care, and they should be evaluated. I mean, you should not have a reaction, A, that you can feel internally with a symptom, or B, that you can actually palpate externally, right? It has to be evaluated, especially if it's persistent. By the time you're ready for the next vaccine, it should have been evaluated so that you can determine what the next step would be.
Good point. Next slide. If someone hasn't been vaccinated, but others in their household have, are they likely to be susceptible to contracting the virus from the ones who got the injection? Okay, so the point here is that as far as we know with the Moderna and Pfizer vaccine, that even though the person who got immunized may be protected from the illness, they could still carry it in their nares and transmit. And this question I've been asked for 2 or 3 weeks now.
Mm-hmm.
Next slide.
And this is about wearing vaccines. We talked about it earlier today. Mm-hmm.
With the apparent vaccine shortage, is it okay to mix the vaccines? I got the first Pfizer vaccine and am due again on February 1st. If I can't get that one, but I can get the Moderna, should I go ahead 4 weeks after the first Pfizer or 3 weeks? Or is one vaccine injection enough for now?
I don't think anybody has an answer for that. So, because that has not been studied. So that's a difficult question, but I would say if it were me, if it were a patient in my practice, if it were my child, I would want to continue with the same vaccine. So I think that would be a question for who? I don't know who could answer that question.
I think this is going to happen. Hopefully they'll collate the data because I know in some countries they are doing this, but at this point we don't know. The science doesn't know. Mm-hmm. Next slide.
And I know we think it's not ideal, but I think if it has to happen, I'm not saying it should, but I think hopefully they will collate the data, as you mentioned.
Yeah, and then just reminding you that after the first Pfizer vaccine in the phase 3 clinical trial of 44,000 patients that ended around Thanksgiving, after the first 1 week after the first vaccine, there was about a 50% protection. With the Moderna phase 3 trial, which had 30,000 people, after the first week, there was about an 80.2% protection. But again, not following their protocols is not ideal at all. But a lot of this is not ideal. Everyone's trying to do the best they can in really difficult situations.
Taking the supplements and improving your own immune system so that it can respond to the vaccine is very wise. It's a no-brainer, right?
100%. And there was a question in the chat about if they're inflamed after the vaccine, how to support them. Well, with our protocol, but especially upping the curcumin. I know that BCM95, which is a specific type of curcumin, there's a huge margin of safety and a lot of good studies in humans on that particular curcumin. And you can go up to 5,000 milligrams. So it comes as 500 milligram capsules. Normal dose is 1 twice a day. But if you're hurting and inflamed, you should really increase that dose, as well as omega-3 fatty acids, which decrease the inflammation, as well as keeping up with the CDAWS protocol and the quercetin we talked about.
And curcumin can often be used to treat pain. So if it's pain in addition, obviously, with inflammation, I think it makes a lot of sense.
Absolutely. And then those local reactions on the arm and the neck, I think just plain old ice as well, because I know there is pain and inflammation there. So continue to send in your questions. I hope you like this format where we're actually collating your questions and putting them on the next deck. And I think that'll wrap it up for now for this session on Kick COVID-19 to the Curb, going back to the basics and prevention. Thank you all for coming. Thank you, Dr. Kathleen, and we'll have Audrey wrap it up. You all for now be safe, be well, and God bless you all.
Enjoy the sun, lucky people. Thank you. Talk to you soon. Ciao, ciao.
Okay, thank you for a great conversation to the doctors. That was awesome. And before we let you guys go, I'm just going to quickly go over the supplement and book offerings we have for this week. So I know that both of the doctors dived extensively into this basic immune pack, but I just want to let you know where you can find it. So it's on FIRRIMup Doctors Get Healthy store. And if you go ahead and use that link, it'll bring you to a page. And then right up at the top, we have each bundle that you can just click on and it'll bring you straight to it. And it's color coded. So the blue bundles are going to be the standard version, and then the green bundles with the little leaf is going to be the vegetarian and vegan options. And so this is the basic immune system pack bundle, and like they said, it's the CDAWS Q+. So we have the neurobiologic vitamin C 1,000 milligrams. We have 2 options for the vitamin D3. The one on the left, the D3 2000, is going to be the standard, and the liquid version is the vegan version. And then for our omega, we have Pro Omega 2000, which is the standard, and then the Algae Omega is the vegan vegetarian version. And then for our zinc 30, we have Pure Encapsulations brand, and then Pure Encapsulations also makes the quercetin. And then we have the colloidal silver spray and the Neo 40 lozenges. So all of these are combined in one bundle, so you don't have to worry about adding them separately to your cart. You just click on that bundle and it'll be all right there. And that's on our FIRRMUp Doctors Get Healthy store. And then next, I'm going to quickly go over our books. So of course, we have the Kick COVID-19 to the Curb book. This is the book that this whole series is based off of, so I highly recommend getting it. You can get the paperback version for $29.99 in our office, and then you can also get it online at FIRRMupDoctors.com. If you want the ebook version, it'll be $9.99 on Amazon Kindle, Google Play, and Barnes & Noble. And just to let you know, if you are new to Amazon Kindle, you can get your first book for free, so definitely take advantage. And then just to let you guys know, our January special only has a few more days. So if you buy the Kick COVID-19 to the Curb guidebook in any format, and then you send us proof of receipt, so that can either be a picture or a screenshot of the receipt, we will give you a 20% off coupon for the ultra potent vitamin C and the zinc AG. And then we have Dr. Akey's book, Fine Tune Your Hormone Symphony. So this book is all about regulating and balancing your hormones to create this sense of overall well-being and health. And you can get that at our FIRRMUp Doctors website. And then lastly, we have our Fascia Function and Medical Applications textbook from Dr. Akey. It is available in the office. We have a few copies left. So if you email nfimgmv@gmail.com, we can actually give it to you for curbside pickup, and that'll be $55. And it is also available at the FIRRIMup Doctors website and Amazon as well. So that's all I have for you. Thank you so much for tuning in this week, and definitely stay tuned for next week. We'll be going into post-exposure prophylaxis. So what to do if you've been exposed to someone who has COVID-19. So for now, be safe, be well, and thank you so much.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM Doctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare